Is surgery the only way to fix a bunion? That's the question we get posed at our clinics about once or twice a week. I'm Bridget from the Adelaide Podiatry Centres, and in 15 years, the practitioners here have treated over 15,000 patients, and as I said, this question does get posed quite regularly. Now, in the 15 years, we've only had about a dozen patients actually go through and have the surgery, but unfortunately for those dozen or so patients, about half of them have actually said they really regretted having the surgery, mainly because it's just so really painful. If you actually think about the bunion surgery, it's actually a really big procedure. It involves opening up the foot and cutting and drilling bone. There is tightening and loosening of ligaments and ends up being quite a traumatic experience for the foot. Most of the patients on average say it's about 3 to 6 months until the foot is fully pain-free again. And you've only got one foot, so that means getting around with a crutch or something similar to that. And then there's the cost. It's usually cost anywhere between $5,000 and $15,000, so that must be taken into account as well. In saying that, bunion surgery definitely does have a place. We have seen some very good results in the other half of patients, but we must bear in mind this surgery being so significant must always be treated as a last resort, mainly because it's just irreversible. Once it's done, it's done. And that's why with those patients that said they regretted it, one was the pain, but there was also after effects. The foot wasn't quite the same. The surgeon may have nicked a nerve or not quite aligned it right. So it is irreversible. Once it's done, it's done. The key to treating a bunion is actually catching it before it gets to the surgical phase. If we can do this, we can do one of two things. We can make your foot pain-free, so when you walk and when you exercise, it won't hurt. You can do what you want without any sort of restrictions. The second thing is the lump itself. We can stop it in its tracks and reduce it from getting any bigger. And that's one of the major concerns. People are very concerned about the way it looks, so we can stop it from getting any bigger. So, if you want to see if you're in that phase before it requires surgery, I strongly suggest you do it as soon as possible. We can do this at our clinic. All you need to do is go into our website and book online. Alternatively, you can call us on 8239 1022, speak to Tiana or Sean, and we should be able to sort out an appointment to assess the bunion. And hopefully we can catch it before it needs surgery. Hope that all helps and clears up some questions, and we'll speak to you soon. Thanks.